Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, and now I'm doing dental practice brokerage countrywide, nationwide. So call us anytime. Today's topic is seller of a dental office questions. Am I ready to retire? There's multiple answers to that question. We'll get into it. As you know, we have 10 employees. We're involved in 25 states around the country, and we're available to you 363 days a year. We take off Christmas and Easter, and you can call us at 201-663-0935. Our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So call us. We'd be happy to talk to you. Now, if you are, and once again, everything you're about to hear is for entertainment purposes only. If you have a larger practice grossing $1 million or over, let us know. We work with some. You may be a candidate for one of the DSOs if you have 5 operatories or more, or you're willing to stay on 3 to 5 years. You could be a DSO candidate. And there's some pretty good DSOs still out there. Of course, some are having some trouble, but others are pretty solid. They're conservative in their approach. And we can help you. We know who the winners are, and we've been doing this for a long time. Often, these DSOs who we're not affiliated with, we just work together with them, 142 of them. We're not employed by them. But they'll often pay our commission. So you'll be in a situation there's no commission to you many times. So just give us a call and we can chat with you about that and give you more information. But we're more than happy to talk to you about it, explain everything, and then we'll go from there. Now, in addition, if you're selling a dental practice and it sells for over $1 million, closes for over $1 million, often we will pay your legal, and we're representing you, often we'll reimburse your legal fees upon successful closing, based on certain criteria, like utilizing a well-known dental attorney. And we've done this many times. So call us on that. We could explain how that process works. So what is this doctor asking? The doctor wants to know, are they ready? Is he ready? She ready? Are they ready for retirement? What do we advise? Well, there's a couple different answers from that. One of them is, do you have some level of financial security, or do you have a significant other that is currently employed and still working? And how long are they going to work for? Those are some of your biggest questions. But the other side is, if you've been working for a long time and you have some level of success and savings, and you have a spouse at home that is, or a significant other that's still working, and you want to get out, absolutely get out. Why do I say that? Because I'm dealing with disability all the time. Constantly dealing with disabled doctors around the country. The latest, as you may know, doctor was rollerblading. I guess he's trying to get his youth back, or her youth back. They were rollerblading and just took a bad fall and had permanent damage in their operating arm. Permanent. Has to retire. So if you were to speak to this doctor 2 weeks before the accident, and you get all your numbers together and all the professional opinions and accounts and everything, they may have said, oh no, don't retire, just work a few more years. It sounds great in theory. And many doctors, as I've mentioned multiple times in the past, mention how long their family had lived for. So they don't have a problem. But they don't talk to you about accidents like this one. Rollerblading and down they went. So you've got to understand that there is there's a level of danger in health and disability that will always be there. As you age, it will increase constantly, and you can never predict it. So that's one way to look at this. Yeah, you got up before you're ready, and you got top dollar for the practice, and maybe you could have stayed on a few of your years and everything works out, maybe not. So the answer is get out. If you have other income coming in the house, of course you're going to speak to your professionals. I'm just giving you my opinion on these things. But I've seen too many problems before. Dentistry is getting harder, especially with the PPO insurance reimbursement. It's terrible. So you're feeling the stress, just get out. I got out when I was 49. I missed the patients, but then I never did any of this reduced fee dentistry. It's like, forget it. I wasn't going to do it. But that was 20 years ago. It was just ramping up. Now it's all over the place. Sometimes you have no choice, but still there's ways that you can be very successful without joining the insurances. But you've got to market, advertise, website, and so forth. So my answer to the doctor was, if you want to retire, just retire. And do it now, is my opinion. Because if you're tired, you're exhausted, and what does it make doesn't make sense anymore. And if you have a spouse at home, and if you've had some level of financial security, some level of it, just get out. Just get out now. All right, thank you, team. Hit the subscribe button if you want to hear more of this. We're getting new practices all the time, especially doctors that bought from us 13, 14, 15, 16 years ago. Those buyers are becoming sellers now. So we're getting older practices. Thank you. Bye.